Many patients need extra help managing their healthcare needs. DukeWELL, a service provided by Duke Health, supports patients in achieving their health goals. DukeWELL can help patients understand instructions from their doctor, get assistance with medications, connect with a specialist when referred by their primary care doctor, find community resources when help is needed. Let's meet a DukeWELL patient. This is Scott, 65 years old and recently retired due to declining health. He has COPD, heart disease, and type 2 diabetes. Scott is struggling to manage his growing healthcare needs. Scott gets help from his wife Nancy, who helps him manage his special diet and takes him to his doctor's appointments. Nancy worries because Scott has become depressed about his health challenges. She's concerned they won't be able to manage Scott's needs and his health will continue to decline. Scott's primary care provider refers him to DukeWELL, and he is enrolled in the Complex Care Management Program.
When my patients have the opportunity to work with a DukeWELL care manager or with the DukeWELL team, they learn a lot more about the condition that they're being treated for. It really can be at a much deeper level than what I have time to teach them in the context of an office visit. We have typically 20 minutes. There's all kinds of things to do in the visit. With a DukeWELL care manager or other members of the team, they can really ask questions, go over things in much more detail, learn about how diet or activity level or medications work and what things they need to do to really better care for themselves. And that kind of background really empowers them to ask good questions of me and to really know more about their health condition, what they need to do to improve their health outcomes or to prevent a time where they might have a worsening of their condition that would otherwise result in an ER visit or hospitalization. Now it can often be avoided.
Scott connects with a DukeWELL care manager who visits him at home to do a comprehensive health assessment and evaluate other factors that may be impacting his health. Together, Scott and the DukeWELL care manager create a personal care plan to help Scott manage his conditions and reach his health goals.
As a complex care manager at DukeWELL, we work with the interdisciplinary team, and that consists of me and the patient's input, talking to the providers, and with comorbidities, they have more than one diagnosis. So I'm calling the cardiologist, neurologist, any specialist to coordinate the care because it's not just one system failure that we're dealing with multiple ones. So that would put the team together. And anytime I'm at like a standstill, then we go to a treatment team and we, talk about one patient with the physician there and the other team members to discuss how can we manage this care since it's so complex. And I've taken a couple of my patients because the patients were so complicated that we needed extra resources to provide the care.
Over the next several months, the DukeWELL care manager works with Scott to help him stay on track with his plan. They consult with DukeWELL's dietitian and pharmacy team to help Scott and his wife better manage his diet and medications.
I provide medication education, making sure that the patient know how exactly to take the medication, telling them information with regards to administration, side effects, drug-drug interaction, and basically answer any types of questions that they have regarding their medicine. And then lastly, trying to determine if there are any other types of assistance or guidance that I can do with regards to medication access.
It feels good to know that you link somebody up with a resource to help them get a medicine that they were either not taking because of cost or trying to stretch to make that supply last when it's a medication they shouldn't stretch. And so in the end, you're helping them get medicine that helps them to stay healthy and stay out the hospital and just to be a better person overall. So that's really rewarding.
The DukeWELL care manager also helps Scott schedule some appointments and get transportation assistance when Nancy is unable to take him to appointments. During Scott's time in DukeWELL's program, the care manager documents Scott's progress in his electronic medical record so she can stay connected with Scott's doctors. They monitor Scott's progress and provide guidance and additional focus areas. Today, Scott is feeling better than he has in a long time. He has a better understanding of his conditions and feels more in control of his healthcare needs. Scott and Nancy both appreciate the support and coordination between DukeWELL and his doctors. DukeWELL works with patients like Scott every day. To learn more, visit DukeWELL.org or call 919-660-WELL.